you mentioned critical culture was at Mallinckrodt and some of the companies where you were in your teams and your management style. So is there a specific return on investment that you witnessed yourself as a result of a culture initiative or when you implemented it? Because that's one of the questions that we always get, when we try to implement it. That's why people talk about it rather than actually implement it, right, in real life in many different environments. How were you able to implement the culture initiative, and what did it do in terms of ROI ultimately?
Good question. I don't want to get too specific, but I'll say one thing is you have to develop a good working relationship with marketing and sales.
Okay.
And in fact, I have a talk, you go on my LinkedIn profile, you can download the slides that I did at I for Pharma called Sales is from Mars, Marketing is from Venus. Because people in sales are short-term, action-oriented, drive today. Marketers are analytical, strategic, drive the future, and they're very different thought processes. And they may be wanting different things, right? But you have to align on what you're working on, because the worst thing you can do is point fingers. And that does happen. So align marketing and sales so that there's no finger pointing. I think that's like the most important thing, is that the senior leaders have got to be aligned. If that's not aligned, game over. Like, it's not going to work. Don't even worry about anything else. Which means you got to support the marketers if you're a sales leader, and you got to support the salespeople if you're a marketer, right? And you got to align around it. I think that's really important, creating an environment within the organization of alignment and culture. I think the second thing is a lot of it is like really walking the walk. It's like, a lot of people forget that when you're a functional lead and you're sitting at the table with other functional leads, that you're responsible across functions to lead that part of the organization. But you do have a degree of advocacy to your own function. You do have a position that you need to be prepared to support, right, of the sales organization. And I think a lot of the time that's where people get a little bit off, right? But you do have to have that, because your team needs to know that you know what they're doing, that they're working really hard, and that the company values it. And so you need to build that value proposition across other people, and also stand for the things that your function is going to need to be successful. And I think that's really critical. And your teams need to know that you're doing that.
Yeah.
And the third thing is, in the sales team, look, at the end of the day, sales forces are volunteers. I don't care how good you are as a manager, a national sales director, a vice president. You can't get out in the car with every single one of them every single morning and make sure they get out early and go home late, right? You just can't do it. And even if you could, those people are motivated extrinsically. They're motivated from the outside. They may be motivated by fear, right? It's not good. So salespeople need to be inspired. They need to know that what they do makes a difference. In what way it makes a difference, to whom it makes a difference, why it makes a difference. They need to be recognized for that, rewarded for that, right? Supported in what they're doing, right? Those are really critical things. That's the walk and the talk of the culture that makes the biggest difference. And then the other thing you need to do is leave them alone.
Yeah, the best government is one that's least governed, right?
Right. If your senior leadership needs reports, make reports. Get them to help you. But come up from the bottom. But don't send them spreadsheets to fill out. Don't keep the look. A salesperson's function is selling.
Yeah, selling. Yeah.
Right. A butter knife is used to slice butter, but they're very often used as screwdrivers. They're not good screwdrivers. Right? Salespeople aren't analysts. They're not marketers. Right. And every moment they're not talking to a salesperson, every moment that they're talking to the company and not a customer is a moment of opportunity cost that's wasted.
That's a great insight. I hope people listen in to this. Yep.
Yeah. You keep them at home doing your spreadsheets. They're not talking to customers. Oh, and by the way, when they do, they're not excited about it, because that's the other element of sales. Selling is as much a transfer of energy and emotion as it is information and persuasion. If you show up as a salesperson with the best message in the world and you're not engaged with your organization, that the customer leaves with that. They leave with how you show up. They don't leave with what you talked about.
Yeah.
So if you're a sales leader, you need to be giving energy to your salespeople all the time. And I mean all the time.
Mm-hmm.
Now, and I always tell the sales managers, like, you need to know, they need to know that you value them more than anybody else could. It's like a relationship, right? If you're not valuing a relationship, someone comes along and like, hey, kind of like me, I might value you more.
Right.
I might think about it, right? But if in your relationship, you know, hey, I'm valued more than anybody else is going to, that makes a huge difference. That gets right back to what I was going to talk about in terms of ROI. In rare disease, especially, I think in anything, but in rare disease especially, the relationships that they build with their customers really, really matter a lot, right? And if they leave, it takes a long time for someone else to go back in there and build those relationships. And in that period of time, the business falls. So a big part of leadership in a sales organization, in addition to doing everything well and giving them a reason to believe and inspiring them, mm-hmm. is managing your turnover.
It's expensive and time consuming.
Very expensive, very time consuming. I mean, and we had a lot of turnover, and it was because it was a really hard job. Mm-hmm, mm-hmm. And there were companies with other, newer prospects.
Right.
Everybody had relationships across the business. I mean, it was challenging, but I think we did as good a job as you could possibly do. I don't think anyone I genuinely believe no one left the company because they wanted to leave the company. There may have been a better opportunity. There may have been something that was compelling for them to leave, but they didn't leave because of their manager. And that's why most people leave.
Right. Dave, thank you so much for that insight, because the words that I heard you say, stand up, when you stand up for your team as a leader, then your team also ends up standing up for you and not leaving for other prospective companies, right? Like based on your example. And I use those words a lot, at All Out Coach in my videos and when I coach individually as well, personally. I tell a lot of people earlier in their career that character means standing up for yourself, but a strong character is when you stand up for not just for yourself, but for others. That's really what I took out of your examples there, being able to stand up and address the what's in it for me. You talked about...
I want to say one more thing right there, though. It is the personal touch that makes a huge difference, though, from a leader. I really want to apologize because one of the most important mentors I ever had, I didn't mention, and his name is Mike Kasich. And Mike was the head of the business unit of neuroscience at Shire. And unfortunately, he had a very rare disease called Ehlers-Danlos syndrome. Uh-huh. And it killed his father, 3 of his brothers, him, and his son.
Him also. Mm-hmm.
And Mike died at the age of 49. But Mike was one of the most authentic and personally engaged leaders I've ever met in my life. And he genuinely cared about people. If you stood up at a meeting and you gave a presentation, you were going to get a personal note from Mike telling you exactly how well you did.
Right.
No matter what. And there's this framed picture out there that he gave to one of my friends, and it says, that thing you've always wanted to go do? Go do it. Yeah. And his life was such an inspiration. At his funeral, they played the song Lucky Man, because he said, in spite of everything in the short span of his life, he was a very lucky man, and he was a really wonderful human. And I say that because if you're a leader of any type, inexpensive, unexpected, thoughtful acts of kindness, communication, personalization, it matters. I used to call the reps on the phone all the time when I was a national sales director. And at first they're like, why is he calling? What's going on? And then I'd say, hey, I was just looking at the results from yesterday. You did a really good job. Congratulations. And so it got out in the field, like, if you get a call from Dave, it's okay. Mm-hmm. And so I actually started building really close relationships with a lot of the reps. And I tell the managers, I'm not managing around you. I'm not doing your job. but they need to know that I'm here and that I care about them, right? I'm not going to do your job. I'm not going to.
Yeah, that's the Dave Giles brand that you were able, personal brand that you were able to build, and that I'm glad you just shared that example, which is
and like when we went to President's Club this last year,
uh-huh.
I wrote a personal note to everyone at President's Club that I met, and a lot of them weren't even on our therapeutic area, but I wrote a personal note to everybody to be given to them on the day before we left, and I gave them to the travel people and said, take these around to the rooms. Yeah. And I would write exactly like Christian Fumarola. I really enjoyed going fishing with you and your wife. It was a tremendous amount of fun. Please tell her that I said hi. Best of luck in Florida. Talk to you soon, Dave. People, it's a forgotten gesture, but just taking a minute to call somebody or write a letter, it's critical.
Yeah. I have a story about being the leader of the people and people standing up for others as well. At one startup where I worked, I was at a Christmas party. We had a great product. It was the next generation product that had the best efficacy safety profile. But we were fighting against a giant, basically, a giant with many more resources and everything like that. So to make a long story short, company failed, company was failing. But I was very close, even though I was in medical, I was working very closely with my commercial team and partners, really, my partners in New York. Because I really believe that sales is also taking part of the patient continuum of care to the same degree as the medical or field medical liaisons are as well, right? And, I was at this Christmas party and they tell me about an executive who had left, and they kind of joked saying that, oh, did you have him fired, right? And I said, no, why would you say that? And they told me this personal story where apparently he started to question some of my relationships with those shared customers in New York in the same ecosystem in front of a different function, even though this was an executive of medical. A lot of these sales reps, apparently, when they were questioned about my relationships and my activity or my intentions,
right?
Because of the relationships that I had formed over the 2 or 3 years with these commercial teams, they got up one by one and they defended me because they trusted and they knew the intentions that I had and the relationships that I had formed with those same customers that they were seeing for other reasons, right? And that really made me upset, I'll be honest with you, because I was misunderstood, but also it made me feel very empowered, and it was the impetus for why I started the whole All Out Coach project on my personal time, because I realized the impact that I could have based on what I do and the relationships I form with others, Dave.
Yeah.
And so the standing up and your stories really, really resonate with me personally as well,
Yeah.
And I wanted to share that with you.
Well, thank you. It's the situation you just told me is that person was threatened because you had better relationships with some of the company's most important customers than they did.
Probably, I don't know.
So they were trying to position themselves politically internally that they were bigger than they actually may have been.
Right.
That's my suspicion.
Yeah. I wanted to ask you about your relationships with field medical, with medical affairs. I know that you have led commercial sales teams, but I mean, what is the role of the medical liaison? Because I know a lot of them may listen to this podcast. If you can address them just briefly, that would be great in terms of their role and now and in the future.
Yeah. So I have worked a lot with medical affairs over time in a lot of different roles. Obviously in sales and sales leadership, although there is it depends on the company, but there is a bit of an arm's length relationship, a bit of a firewall between the salespeople and the sales organization and the medical science liaisons. And just, again, companies are all different. And I'm not 100% certain of the most recent compliance for that, so I don't want to comment to it. Things change, right? But I do know that there was a separation. But I had the opportunity also when working in commercial and strategy on a brand in lifecycle management to work with medical and with R&D to provide commercial perspective to future research programs to pursue other indications, because we had the data and the product strategy long-term, and they had their data And, so I could say it would be commercially valuable if we could get this indication. I said, well, our studies seem to signal that we could have a positive result with that kind of trial. Okay, what does that mean commercially? What does it mean R&D? So I've had a lot of experiences with R&D in that sense, and medical affairs. But I would say, to me, and I'm actually going to rely on you a little bit more, so you check me on this.
Sure.
But to me, maybe I could tell you what I don't think salespeople should expect of MSLs.
Sure.
I don't think a salesperson should expect an MSL to come in and sell.
Thank you. Yes.
And I don't think the fact that an MSL won't come in and sell means that they're not doing their job or they're not a good MSL. Because there are some salespeople who will bring in everybody else to sell for them. And I give those people a lot of credit because they are smart in using their resources. But I'd also say you can't do it that much sometimes. I think that it's the responsibility of the MSL. I think it's two-way. Mm-hmm. One is as a liaison to the academic and thought leadership communities of any disease state or therapeutic area. It is about having those relationships, understanding the needs, and also the focus of those individuals, because they're all different, right? And then to me, I think that the MSL should own that relationship with those, with their customers. Just like I think that specialists should own the relationship, salespeople should own the relationship with their customers. Because too often, if everybody tries to own the relationship, no one does. And inevitably, you're going to have coordination breakdowns and the left hand and right hand aren't talking and it looks bad, right? So I think someone's got to own the relationship. And I used to always tell the reps when I was out with them, look, I'm national sales director. I'm not here to own your relationships, but I'm here to support you in owning them. I'm here to help you. I think that's the way companies should think about MSLs. It's like you own the relationship to the point you were making earlier. The MSL owns the relationship. When we want to liaise with Dr. X, Y, Z, we need to work with the MSL to coordinate that activity to make sure that it's seamless, right? Because I don't think companies do that. Like they'll see someone as a global thought leader, and then the next thing you know, the head of some function in headquarters is like talking to them, and then their MSL doesn't know that, and they go in and say, oh, I was just talking to the head of your such and such, and they're like, huh? Right? So there's a lot of customer relationship management there, but it's important for the MSL to be the hub.
Absolutely agree. And that is a dilemma. That is a real, I can confirm.
Oh, I know.
MSLs as well. Yep.
I know. I'm going to give you the flip side of all this in just a minute, but let's say that's the way I think it ought to be. Right?
I agree completely.
I also think the companies that MSLs have responsibility to provide input to commercial, specifically on the marketing side, and also to medical affairs, about the trends that they hear about from their customers and other insights that their customers may generate that can help inform strategy. Not necessarily the execution strategy, but definitely strategy. And I think that the marketers and everyone else needs to actually listen to the MSLs. Because one of the things that I've found about MSLs is sometimes if you're the MSL who's willing to say what needs to be said, they don't want to hear it. Right? So the company needs to be open to hear what it is the MSL is bringing in, and not necessarily be dismissive of it.
Right.
And the MSL needs to understand that the company actually wants to hear it and isn't just bringing them in because they need to show that they're working with the MSL.
On all our coach, I say positivity is a reaction, not a perception.
Right.
That's how I kind of see
right.
that distinction that you just made. Mm-hmm.
Right. So, but here's the challenge if I'm a company. And this is the thing that I think the MSL community has got to figure out an answer to. If I'm the company and I've got 50 key opinion leaders and I've got X number of MSLs, and I say the MSLs own the relationships. MSLs are that's like the hottest ticket these days. And MSLs are moving around, right? So I don't know if I want to hire an MSL and build relationships for them if they're going to leave. Right. But flip side is if I hire an MSL who already has relationships, it's valuable to me. So I think there's got to be something in the contract between the two. And I don't know the answer to that, right? Because I think if companies are doing, like when you were describing what you did earlier, in my mind, I was thinking, why would they do that? Like, that doesn't make sense to me, but why would they do it? That's the kind of reason why. It's like they're thinking, I don't want to, as a company, we don't want to lose the control of the relationship. Right?
Maybe. Yeah,
I think that's the challenge, is just, and maybe the way the MSL could do that is demonstrate to the company that they are acting in the company's best interest at all times. I mean, maybe even going above and beyond to demonstrate that. Okay. I've seen some really good leaders in medical affairs and any other function, and I've seen some not as good leaders in medical affairs and other functions, right? I think it's challenging for MSL sometimes to have a good leader, because a lot of the things that you learn in leadership on the commercial side, I just don't know. I don't know what medical affairs teams do to help leaders of MSLs learn those same experiences.
Yeah, those soft skills, which is really a misnomer, which they're not soft, they're actually critical.
Right.
Hard to learn, hard to really adapt and adopt into your...
Well, by the time you've gotten to an advanced degree, you've got a PhD, you've had to deal with defending your perspective enough times that that just becomes ingrained into who you are. And you've got to be critical of other people, so they have to think through what it is that their perspective is. But I think you just have to acknowledge that. It's like I've always told people in meetings, I always say, look, my bias in this decision is to go this way. So I'm just telling you that. I'm disclosing that, because if you're going to convince me, I need to understand why going this way is better than going that way, right? And I'm willing to listen to you. That's the other thing. I want to hear what you have to say, because I always tell people, I own my opinions. They don't own me. Yeah. If I get new data, I'll change my mind, because the opinion doesn't own who I am. I own it as part of my thought process, right?
Yeah, there's a scientific method to sales and to everything that we do. Yeah, that's right. The pure scientific method. Yep.
Exactly.
Absolutely. Dave, thank you so much for a lot of incredible real life stories and lessons. I want to ask you one question about what your escape is, so that people can get to know you a little bit more personally. What are some activities in which you kind of lose yourself? I like to ask this question to leaders, during my interviews.
Oh my goodness. Well, we talked about this earlier. I'm really passionate about making a difference. And what I'm trying to do right now is I actually have a plan for the things that I plan to do over the next few years. And one of them is to drive the awareness of pheochromocytoma so that more people will be appropriately diagnosed and we can impact the outcomes of lives there. I think that's incredibly important. Yeah. I would like to continue to mentor people and help them grow and develop. A lot of people that I've worked with call me, I tell them, look, advice is worth what you pay for it. And I don't charge, but I like to stay involved and help people that I've worked with, because I see them be successful and it makes me feel positive about that. A good friend of mine calls me a solutionizer. Like, I like to solve problems. But I personally think, although I'm not a scientist or a physician, I think there are things that we could be doing as a nation right now to help people, not necessarily treat the COVID-19 virus, but prepare their bodies so that they don't overreact from an immune or inflammatory response and cause more problems than need be, right? Mm-hmm. A good friend of mine once had on his office wall, it said, the biggest problems we have today are caused by trying to solve other problems, unintended consequences. And I think a lot of what happens with any of these infections mm-hmm. is it's the overreaction. I'm clearly using lay terms. The overreaction of the immune response and inflammation that causes the end organ damage, or any other the real challenges that people are dealing with. And I think it's understanding the cytokine storm, and what you can do about it. So I think that there's if I were talking to MSLs, I'd say learn about what can be done to help people, simple things that can be done to help individuals who could contract this infection, to help their bodies manage the reaction better. And again, I'm going to send you some slides that I've thought of, but I'm really passionate about learning, and I'm reading a couple of books right now I'm very excited about, but that's what gets me excited. And I think the other thing is just seeing my kids. Like that's the most important thing. Would you agree with me, Cooper?
Yeah.
See, he agrees with me. I mean, I always say that
walking the talk.
Yeah,
That's how I've known you all my life, and thank you.
Come here, Cooper. Can you come here?
Yes.
We call your brother too, but no. What is the number one rule of Dad? Come here.
Dad always does what he says.
Did you hear that?
Cooper, let me say hello to you.
Cooper, come over here.
My name is Tim Cooper. Hi.
Hi.
Lean down.
You have a great dad. I respect him a great deal.
Oh, thank you.
Yeah.
What's the number one rule of Dad?
You always do what you say.
You always do what you say.
Always do what you say.
Yep. So I always say, I've never been happier in my life than seeing my children be happy, or seeing them be proud or accomplish something. And it's even small things that make me happy. And the boys will tell you I tear up all the time, and I always have. But I am literally that proud of them. I mean, they are wonderful humans, and they amaze me every day. So,
Dave, thank you very much. In beginning with that one short interaction many years ago when I was starting my career, and now being able to reconnect with you due to different transitions in my career, different shortcomings, and even a tragedy in your life and your family, I'm still very, very grateful for being able to have your time, your mentorship, your leadership, because it has impacted me and my life and my career. So I can't thank you enough once again, Dave, for your time. And I look forward to sharing a lot of great news and successes with you in your every initiative with pheochromocytoma and more. And I can't wait to hear some comments from those who are going to listen to this podcast.
I'm excited about it too. But listen, I'm honored and humbled that you would even ask me to do this, and it's my pleasure to do it. And I'm glad to help anyone in any way that I possibly can. And let's you and I stay connected. And if there's other ways that I can help, I'm certainly glad to do that as well. But thank you for the opportunity.
Thank you. Thank you very much.
Take care.
Take care. Bye.
Bye-bye.